Hello and welcome to today's NAC OSCE tutorial. I am Dr. Faye Kemi with STARMED Medical Education Programs. Today we're just going to be talking about vaccination, how to approach this in a NAC OSCE examination, how to ask questions, and how to offer proper counseling in this situation. And we're just going to have a case study. This is a patient, Laura Brown, a 25-year-old new mother who presents to you with questions about vaccination. Her vitals are stable, and um, the prompt here is to take a focus history and address her concerns in 11 minutes. Now, this is an 11-minute station, meaning there is not going to be a post-encounter. That means that you have your entire 11 minutes to talk to the patient and you're not going to have to speak to the examiner at all. So the approach here is to enter the room. You can sanitize your hand, greet the patient, introduce yourself, ask the patient how they would like to be addressed, clarify their reason for the visit. And while you take your history and counsel, you should do what we call fifing, which is explore the patient's feelings, ideas, function, and expectations from the encounter, and then properly address their concerns specifically, and then establish a plan for the visit and subsequent follow-up. So how do you take your history? The first thing you want to do is inquire about the patient's parental concerns about vaccination. What exactly are they worried about? And then take a history from the mother or from the patient that you can see about any red flags, any prior vaccinations with anaphylactic reactions or their state of health, immunodeficiency, any other diseases. You can also ask for history of any organ transplants, splenectomy, medications like immunosuppressives or over the counters. Also necessary to clarify allergies because a lot of vaccines contain things like eggs and things that can cause allergy. So it is necessary to also figure that out from the patient. Also, their last immunization, just their immunization history and any adverse reactions, seizure disorders, or any severe reactions that they've had. And then socially, you also want to know about their travel history, breakouts in their community, ethnicity, and recent immigration status as well. And then the next history you want to take is the history of the child. And we use the P-bind approach. So you ask about the circumstances surrounding the pregnancy, the birth of the child, immunization history, if the child has had any immunization at all. This is, considering the fact that they're here to discuss their child's immunization status. You also want to explore nutrition of the child. Is the child on breast milk? Is the child on formula? Is the child developing well? Any concerns? Environment, you want to also always rule out possibility of abuse. And then we get into counseling about immunization. So this is an immunization schedule that basically in Canada, different months, different vaccines taken, from the DTaP to the MMRs and varicella and hepatitis and all of that. This just shows the schedule, which the immunization clinic would always follow up with the patients whenever they're scheduled for vaccination. So it's not something you need to really cram in your head. You can always refer to this. So, common misconceptions about vaccination. So the first thing you want to do is clarify what their concerns are. And most of the time, it usually is a misconception. The most common misconception is that it is related to autism, and that was a study done in 1998. And since then, it has been refuted, and apparently, a lot of fraudulent activities went on around that time. So, that theory is not valid, and so that is one major misconception that would need to be addressed. Also, the use of mercury, which is no longer being used, and safety of thimerosal is also something that comes up, but it has also been um, figured out, and there is no legitimate safety reason to avoid that. Now we want to why explain to the mother why vaccination is very important for her child and what these vaccines are. Want to let her know that we take different bugs, bacteria, viruses, and we put them in non-harmful quantities into the body, so the body develops, what we call antibodies against these antigens. As much as possible, try to break down all your medical terminology so that the patient understands what you're trying to say. And vaccines are life-saving, and not being vaccinated can lead to death or severe infections. And also the benefits of immunization. You have to let her know that it prevents, serious illnesses, infections like measles, encephalitis, meningitis, and all of that. And it also causes what we call herd immunity, which means that individuals who cannot be immunized for whatever reason, maybe immunosuppression, for instance, will naturally get safe from being infected with these diseases because other people are immunized. Now, side effects of vaccination, as we all know, every medication vaccination has side effects. So from mild side effects like pain, erythema, like redness, swelling on the injection site, irritability and rash, um, and fever. And in this case, for the fever, you can tell the patient, that 10 to 15 milligrams per kilogram of acetaminophen, or an ibuprofen for the fever would always work. And but sometimes there could even be like seizures, hypotonic state, unconsolable crying, and arthralgias. MMR can also cause parotitis. So these are very rare, but they're worth mentioning. The patient should always know about all side effects, no matter how less common they are. And also, you need to let the patient know that all of these are not contraindications for immunizations. The only contraindication for future immunization is anaphylaxis, and 1 to 2 out of 1 million children would have an anaphylactic reaction. It is extremely rare, but it is possible, so they should be aware of that. Every other thing is not um, a contraindication, not even a seizure. And educate the patient about fever management, using antibiotics, tepid sponging, and just controlling the temperature. Because most times, even the seizures are as a result of the fever that's not controlled. And in severe cases, if the seizure is not stopping or is recurrent, or in the case of anaphylaxis, emergency services need to be contacted immediately. Here are some components of vaccines that can cause anaphylactic reactions. In this case, vaccinating such patients would be contraindicated, like neomycin, gelatin, baker's yeast, eggs, streptomycin. These are components of popular vaccines that we all take that can cause an anaphylactic reaction in certain individuals. Also worth mentioning is immunodeficiency or active immunosuppressive therapy. So patients following organ transplantation, HIV, high dose steroid use, and pregnancy. Now, in these situations, vaccination will not be 100% contraindicated, but would need to be deferred for a particular period of time. So it might need to be done after 6 to 12 months following a transplant, or early in disease when CD4 counts are high in HIV, or after steroid use for at least 1 month. And pregnancy, usually live vaccines are deferred till immediate postpartum period. And precautions for administration. So certain precautions, especially for live vaccines, um, in cases of severe bleeding disorder, precautions should be taken. If there's a recent administration of immunoglobulins or blood products, live vaccines also should be deferred. And in premature babies as well, immunizations should be given on a regular schedule, but and not delayed. They should not be delayed for a corrected age. So it should be done based off of their actual age. And additionally, there's also the influenza vaccines, which should be given seasonally and are recommended for all, especially in Alberta, all Albertans are giving the influenza vaccine from 6 months of age. Also, travelers, there are some specific vaccinations to consider, like the typhoid, yellow fever, cholera, depending on where you're traveling to. Also, BCG vaccine for TB and RSV. The RSV is specific for certain populations, like um, children with chronic lung disease, less than 2 years old or less than 1 year old with Down syndrome, or premature infants less than 6 months of age as well. Should be given this to prevent having the RSV infection. In summary, um, important things to do is inform if the child is a good candidate or not based on your history. So, based on everything you've gathered, you should be able at the end of that encounter to tell the patient if her child would be a good candidate, and ensure not to bombard the patient with too much information. So giving a piece of information, checking if they understand, checking if they have any questions, and then you continue, and obviously avoid medical jargons, and then tell the patient to repeat information back to you. That way you ensure that they understand. And then offer them pamphlets, brochures, or websites for more information and for further digestion of information. And always schedule follow-up visits if necessary or if applicable, and let them know that the immunization clinic will follow up as well. And in all of this, please do not forget to show empathy, regardless of whatever the patient's mindset is. Do not judge them or make them feel judged. Always show them empathy, show them that you're there to care for them, and you do everything regardless of whatever decisions they make, even if they insist on not having the vaccination. So good luck on your NAC OSCE, and thank you so much.